So today's presentation is from 4Kids, which is one of the largest providers of homeless services to families in Virginia. We're going to hear from 3 people today. Jessica Milloy, which is the Director of Shelter and Housing, Elise Hasenstab, sorry if I butchered your last name, Community Resource Specialist, and Lexi Maratellos, which is the Family Wellness Coordinator. So I will let you guys go ahead and take it away.
Well, thank you for having us here today to speak with you guys. As Amy stated, we are with 4Kids. We start this slide. It is a picture of our new building. So we moved here as of next month in April. It will have been 2 years. And so this was built from the ground up after a few-year capital campaign. And it combines several of our offices that were in Norfolk and Chesapeake all into one. Our shelter used to be on Ocean View, and then our Norfolk administrative offices used to be out on Collie, so really close to you guys at ODU. So this is where we have everything together now, and it is our administrative building as well as our 20-room family shelter. As Amy stated, we are one of the largest providers for families experiencing homelessness in Virginia. We were established in 1988, once again in Ocean View, started with a small shelter from people that were staying on the beach there, and it's just evolved and grown, and we've done so many different things over the years that we'll kind of talk to you guys where we're at today. Just a quick fun fact. These pictures, so we do an art auction every year as a fundraiser, and so the kids come out, well, they do art pieces ahead of time with our art teacher, and those are auctioned off, and so we actually have that coming tomorrow. So it's our biggest fundraiser event. It's tomorrow. It's out back of our property. Last year we raised $1.6 million, and we're hoping to at least meet that goal or better, but it is amazing. People are in the community are definitely buying into the cause, and will buy kids art for $30,000, $50,000. So it's definitely really awesome to see. So send us all the good vibes for tomorrow. Again, we are over here. I guess I didn't mention that our new building is in Chesapeake, Virginia, in the South Norfolk area. That's the one that combined all of our Chesapeake and Norfolk offices. And then we also have an office out in Suffolk that we call the Birdsong Center. And they serve Suffolk, Franklin, Isle of Wight, all those counties out there. And so that we're down to just 2 offices as opposed to 5 or 6 previously. Just some general information. Again, our building was built from the ground up, and we use trauma-informed care as the design model. Our CEO was definitely innovative and creative using that. And so you see it, this is our lobby coming in, and so you see it with the colors. They're meant to be warm and healing, natural light, the light woods. All of that is purposeful and having a welcoming, healing environment as people step in, and that's carried throughout the whole building. Even on the staff side, we have campfire areas for self-care, cool down periods maybe, and then it's throughout the shelter as well. So that is the theme throughout. Last year's data, so we served approximately 290 families each day in our programs. We receive approximately 1,100 calls a week for our crisis hotline, reaching out, touching nearly 70,000 lives a year, and serving 3,000 square miles across southeastern Virginia. Our 3 main areas of focus are housing first, and then education and critical services. So with our housing stability programs, first, everything really starts from the entryway of the Regional Housing Crisis Hotline. Elise will speak to that later in the presentation as far as all the things the hotline does, but that's really where it starts. So we get several calls throughout the week, and some are for resources maybe related to housing. Maybe they need utility bills, or they're having issues with court coming up and they need some education, and so the hotline gets them the resources that they need and talks them through the issue at hand. And then if the family is calling and saying they are at what we call imminent risk of homelessness, so they're at risk of becoming homeless within the next 14 days. Maybe they are staying at a friend's house. They have a hotel, but it's getting ready to expire and they don't have the funds to continue on. They're doubled up, whatever the case may be, that falls into the category of prevention. And that is a small program. We serve about 46, 50 clients a year in the prevention program in several different cities. But the hotline screens them and then places them either at the top of the waiting list or on a list where we continue to screen and call to find out who's the most vulnerable to be in the program. The case manager works with them to see if they have any resources to stay where they're at, if that's a potential longer term. But in many cases, we're helping them find a new unit. We do find in this category, prevention is the only program that we do still serve singles. And so we sometimes are finding like medical homes, group homes, things like that, getting them connected to services, or finding a new home that they can live in. And so that program is about a 6 months case management program, a little more light touch than some of our other programs that we'll talk about. And then if for shelter, if somebody is calling and stating they are what we categorize as literally homeless, they are sleeping outside, they're sleeping in a car, they are sleeping in a hotel that was paid for by another agency, then they meet that category of literally homeless and we screen them for shelter. So that is for our 20-room family shelter. And then in Western Tidewater, we utilize a hotel for our shelter program. So we typically have 7 to 8 hotel rooms for families that are screened there as well. We are almost always full at all times. So it is like people definitely have to continue to call to check in really. At shelter, the services are really going to be crisis management and stabilization. So coming in, we're helping them with getting the basics as far as like getting their vital documents, getting them their ID, the things that they're going to need to even apply for housing or a job, the kids' social security numbers, our cards, birth certificates to make sure they're in school or that we're able to change schools for them. And then peer groups, getting connected to medical resources, making sure they have their benefits. So it's really just that landing place of like, all right, let's get you all connected and kind of stabilized. Shelter stays are about pre-COVID, 30 to 45 days. During COVID, we were seeing up to a year. And now kind of easing out of COVID, we're right around like the 4-month mark. It's pretty typical for a shelter stay. And it really has to do with the housing market. It's tough out there. Really hard to find some units. The housing market did open up last year when the eviction moratorium ended in last July, but we saw a spike in rents. So we're like, great, everyone, we have these units available now, but they're $300-400 than what they were previously. So, and it's something that we definitely have to continue to work on. And then once they're housed, first they start with the housing team. They are a group of people that are just focused on housing. So they're in the community, making relationships with landlords, talking with them, advocating for our program in hopes of getting them housed. And then once they're in our in-home programs is really where a lot of the stabilization work continues. And so we're doing budgeting. We're talking about tenant education, talking with your landlord, continue on with your health. The kids are going to school. So making sure all those are in place and that we are continuing on and setting up goal plans every 3 months and providing supports to be able to help them meet their goals. So we had 85% remained or exited to appropriate housing last year. So that is once they exited to housing and then stayed in housing. Typically, our percentages are even higher, but again, with the tough market, we have seen a little bit of decrease there, but still a really good stat. This is a picture of our shelter room. Again, continuing on with the trauma-informed design, we really wanted it to feel like home, coming to a landing place. And so we were able to design this. The colors are purposeful, the layout. And so you see they do have an area to be able to eat. They have a little kitchenette to the left there that we can't see, and then bunk beds and different rooms. Some rooms have like adjoining doors like a hotel does for our larger families. We actually have 3 larger families right now that are over an 8-person family. So larger families are definitely really hard to house. They don't have bathrooms in here, so shared bathrooms are in the hallway, and then we have a whole dining kitchen downstairs where at least 1 hot meal is served, but there's healthy options throughout the day for grab and go sandwiches and yogurts and fruits and all different kinds of fun stuff up there. A really cool fun fact with our cafe is that we do have a rooftop garden that the Healthy Chesapeake Master Gardeners help us with. And so we grow different herbs and vegetables and berries. And so they use those fruits and items in the kitchen. The kids will go pick them and they'll help with the food. And so they're definitely seeing that the healthy food aspect. It's a really important piece for the shelter. Critical services, this is really for in-home. They stay in our program generally around a 9 to 12 month period. So families are coming in, if they're in the initial phase of prevention, around 6 months. If they're in our in-home programs, 9 to 12 months. We do have one program called permanent supportive housing where the family can stay technically until their youngest child turns 18. But our goal is right around 3 to 5 years, and it tends to stay around that. Focusing on mental and physical health, housing and job placement, budgeting skills, connection to peer and community supports. Another big one is just connection to subsidized housing, getting on the waiting list. We actually have Chesapeake Housing is opening today, their Section 8 waiting list. I mean, it's been years, so it's open today in case you're able to spread that news. We've tried to get everybody signed up so they're on the list. So when their application comes up, if they still are in need, they have that as a backup plan. The education programs, so last year, education team assisted with 133 children, on average, 92% promoted to the next grade. We have several different programs and it's continuing to grow. I mean, I think we're realizing it's really always been a mission to start with the kids to really make the change. And so we have Beyond the Bell, which is an after-school program that's 5 days a week. They're coming in, they're doing homework, they're learning different skills. We have a remediation program that was really born from the time in COVID where kids were getting so behind. And so we have families that qualify for remediation from local elementary schools. We have music programs, art programs. They do summer camps in the summer. And then we're just starting a teen mentorship program in the education department. So during COVID, the impact there is economically disadvantaged students will have lost 12.4 months of learning, so about a year behind. Nearly double that for all K through 12 students. So we're definitely working that and seeing it across the board. The students that we serve, about half of public school students are economically disadvantaged. So you can see that it's a large wide of students that we're trying to help catch up the best that we can. This is a picture of the middle school room. It also serves as a STEM room or STEAM room. And so they can do all kinds of fun stuff there. They have a 3D printer to do cool stuff like that. Over in the corner that we can't see, they have a pet bearded dragon. So they learn about how to take care of a pet and what to eat and all that good stuff. Some woodwork. In the summer, we even had a DJ come out to learn about different beats, and they put together songs and beats. So that was really fun. And then with our art teacher, definitely feeling like art is healing. And so the kids are constantly doing art. It's been showcased in the Norfolk Airport Library and museums, different cafes. So they love to get that out there. All right, I'm going to hand it over to Lexi, who is our Family Wellness Coordinator, to talk about some of our health initiatives.
Hi, yes, so I'm the Family Wellness Coordinator for 4Kids, so I coordinate all of the healthcare needs for all of the families and individuals that we serve. So that could be helping coordinate their physical health needs, mental health needs, nutrition needs, anything that you think could fall into the over umbrella of wellness. So some health initiatives that we have been working on at 4Kids are all really centered around the belief that housing is healthcare and that housing is one of the most researched social determinants of health, and that certain housing interventions for low-income families can really be beneficial on increasing individuals' health outcomes and decreasing healthcare costs. So like Jessica was saying, we have a program that is funded by the federal government for permanent supportive housing for families where their head of household has a chronic disability. And so that is one of the housing programs that we have where we are able to offer them a housing subsidy. They receive ongoing case management services, and their case manager can help them get connected to medical services that they need, can help them facilitate getting home health care or an aid in their home. And part of that is also in my job, I'm able to help coordinate some of the chronic healthcare needs of our families. So if there's somebody that has a disability that they really need help just getting connected to resources, that is a place where I can step in and help facilitate that. And so some really exciting things that we have been working on in the past year. In September, we started a partnership with a counseling service in the Western Tidewater area, that they have a counselor that comes to our office every Thursday, and they provide counseling services on a voluntary basis to any of our participants that want to receive counseling. So our participants can, if they see our space as a safe and welcoming environment that they're comfortable with, they can come and receive counseling services there. It helps make it more accessible. And even in the room where counseling is provided, we have a two-way glass, so they could even have their kids on the other side. They can receive counseling, and it can remove a barrier of needing childcare so that they can receive mental health treatment. So that has been really exciting. Even just the piece of that, we have a really great, easy partnership with them. So even if a participant wants to receive telehealth services, we have a great connection to get that easily set up for them, and they can get an appointment usually the next day or within the week that they reach out for services. And then we also are starting in the next week or two that we're going to be providing on-site primary care services starting at our Chesapeake office. So we have an amazing nurse practitioner that is going to be coming on. We're going to start on a bi-weekly basis and be able to provide primary care services to our participants in our shelter or our in-home participants. And the best part about our partnership with the counseling services and the primary care services is that they're able to keep utilizing them after they leave our program. The nurse practitioner has a mobile autonomous practice. So while they're in our shelter, they can come downstairs and see her for appointments. And then when they move into their own housing, she's able to come to their home to see them or see them on a virtual basis. So they don't have to just start services when they're here with us and then have to find someone else when they leave. They can get connected here and continue using the same community resource. And it's the same with the counseling services, that they can keep seeing the same counselor even after they're out of our program. And that is something big that we like to do at 4Kids, is help get our participants connected to as many community resources as possible so that they have community connections that they can help rely on after they exit from us. The Virginia Council of Nurse Practitioners is also coming on a monthly basis and is providing health education clinics. So we started that this past month, and they did an education clinic on reading nutrition labels, and then did a blood pressure screening. And so we have received some donations of blood pressure cuffs. So if one of our participants has a high blood pressure reading, then they can be sent home or up to their room in the shelter with a blood pressure cuff and continue to monitor their blood pressure at home, and then can come back and check in again with the nurse practitioners that are coming once a month. So that is really exciting, and we've only had one so far, but I am very excited about where that will take us. And then we also received a grant in the past year from Anthem Health that is having us track the health outcomes for our participants that have type 2 diabetes or hypertension. And so those that have self-disclosed to one of our staff that they have one of these chronic illnesses, we measure their health outcomes every few months and are able to provide incentives for them for obtaining a primary care physician or for meeting health goals like going to 3 primary care appointments. And so we're working with them to track the health outcomes for them. And with that grant, they are also helping fund cooking classes that we have on site. So Jessica mentioned it a little bit, but we have a partnership with Healthy Chesapeake that staffs chefs at our office that provide the most amazing, healthy, delicious food that I've ever had. So truly some of the best food I've ever had is in the kitchen downstairs. They make the most amazing meals every night. And then during the day, there's grab and go snacks like cut up fruit and vegetables, yogurt, cereal, granola. It's absolutely wonderful down there. So our head chef teaches monthly cooking classes. that is geared towards our participants with type 2 diabetes or hypertension, but we invite alumni, we invite our current and home participants and our shelter participants to attend. And we've been having about 6 or so participants come on a monthly basis and learn how to cook a meal that is realistic for them to make at home and is nutritious and filled with a lot of vegetables. So we've made soups and pasta, and we made avocado toast. We had a participant that learned to make avocado toast in October, and then she shared with me that in December that her mom came to visit for the holidays and she made her avocado toast, and she was just so excited to share that she did this and was so proud that she had learned about how to cook it. And we had cooked it with spinach and mushrooms. So that was super exciting. And another part of the Anthem grant, one of the families that we've worked with through it, the head of household has type 2 diabetes. And when we first started tracking his health outcomes, he wasn't seeing a primary care provider. He wasn't managing his diabetes with any medication. And we were able to provide him with an incentive if he attended a new patient appointment. And when he first went, his A1C was a number that I can't remember, but it has dropped in half. It's cut in half, his A1C, in the past 3 or 4 months from being able to get him connected to services. So that has been a really amazing part of all of the health initiatives that we've really been able to see improved health outcomes in our families, which really it's all connected. So being able to help improve their health outcomes can increase their ability to be able to work, or can increase their mental health and the overall family dynamic. So it's very important to us to be there to support our family's health needs. And sorry, I have just so many health things to share. So also with the next step in the cooking classes, which is the next phase that we're going to be rolling out, we are introducing meal kits. So think of it like a HelloFresh kind of deal if you've ever done an ordering system like that. So we are going to start it with our families that have type 2 diabetes or hypertension. And once a week, we will deliver ingredients to cook a healthy, nutritious meal that fits their dietary needs for their illnesses that they'll be able to make at home, which is another way that we're able to help improve access to quality nutrition, is that we're going to be able to deliver this to them on a weekly basis. Hopefully it will then expand to that we'll be able to provide these meal kits to other families, but that is where we're starting with, is with them. And here's just a little glimpse of the kitchen where our Healthy Chesapeake chefs are. It is wonderful and beautiful and clean, and I can't say enough good things about it. So this is one of the spaces, this big table is where we'll host the cooking classes, and everyone comes around and gets to cook. They have their own station with their own burner and pot and get to make their own food, and then even get to take a to-go box home or to-go container home so that they can share what they made with their families. And it's always a really exciting time to be able to eat together, and then they want to go home and take it and share it with their spouse or their kids about what they made. And then here's just another view of our cafe in the kitchen. And so our after school program, kids all come eat dinner here every night before they leave, and then it's the same space that our shelter families come downstairs and eat dinner here. So now I'm going to turn it over to Elise, that is our community resource specialist, and she's going to talk about our community resources and our housing crisis hotline.
All right, Amy, would you give me a thumbs up so I can make sure you can hear me? All right, that's what I like to hear. Thank you. Well, it's really great to be able to sit here and listen to Jessica and Lexi talk, because it's at crisis, in the crisis response section at 4Kids, well, we're responding to the crisis, and so we don't get to hear oftentimes about all these wonderful stories. So thank you guys so much for sharing. So there are two separate parts of crisis response that I would like to speak about. The first is the Housing Crisis Hotline, and the second is going to be Resources 757. The first being the Housing Crisis Hotline, it is going to be the first stop for anyone who's experiencing homelessness or soon to be experiencing homelessness in the 7 cities or more. So it's not just Chesapeake or Norfolk, Virginia Beach. We go all the way up to Williamsburg, James City County, all the way out to Western Tidewater for assistance, and also back in with Virginia Beach, Chesapeake, those areas as well. We are a 24-seat call center where, boy, those phones are just ringing right off the hook, unfortunately. And as you can see, because we're responding to so many calls per year, in order to have access to the resources that my colleagues here are explaining, it's important to have anyone who needs assistance contact at the Housing Crisis Hotline. If you have a pen with you, I can give you that number, realizing I didn't put it on here. That telephone number would be 757-587-4202. And that's, for anyone in the 7 cities and then some. So from Western Tidewater all the way up to Williamsburg or so, and back out to Virginia Beach. So there's a couple of different populations that the Housing Crisis Hotline typically chats with. We get a lot of different calls for a lot of different things, but typically it's for these 2 different things. Being those who are housed stably, perhaps just needing a little bit of assistance with rent or utilities. And for some of those resources, referrals are going to be required. An example of that would be the Salvation Army or Catholic Charities. They would have to give us a call here at the hotline just to make sure that they get the right referral and are screened for potential assistance. On the other hand, sometimes referrals are not required. Sometimes the Housing Crisis Hotline is aware of a church or mosque, synagogue, a YMCA down the street, something to that effect that's able to provide rent or utility assistance, but is not required to have a referral. On the other hand, we do also speak with the unhoused population, or unstably housed is really how I should have put it here. So please forgive me in my error here. And as Jessica mentioned so eloquently earlier, we have 2 sort of different selections of folks who call. We've got the people who are trying to prevent from becoming homeless. What can we do? Maybe we can help them with their rent or utilities to prevent the homelessness. And then we also have our literal families, those who are actually sleeping outside. Oh, thank you for putting that number up there. I appreciate that. That's perfect. And so again, most of these are going to be different than the house, because very, very typically those are the folks who are calling in who are unhoused or unstably housed are going to need referrals to one of our programs. And moving right along, let's see. So when should somebody call the hotline? You're saying, well, they need to be housed, or maybe they don't need to be housed. Well, again, anytime someone is homeless, meaning sleeping outside in their vehicle, at a shelter, at a hotel paid for by a church, something to that effect, or soon to be homeless. Maybe they got that eviction letter on their door and they're not able to make that payment. They're going to be out soon. Or needing resources to prevent homelessness. Those resources, they come in a lot of different ways, and so a lot of different venues. And so giving us a call, we know a lot of those resources, and we're happy to help brainstorm for sure. Any questions about the housing crisis hotline before I move on to resources 757? Okie dokie, let's move on. And resources 757 is a website that has been created by 4Kids and Crisis Response to address, well, for those who need resources in the 757 and surrounding areas. There's some really great benefits to using resources 757. Let's say you are sleeping in your car, you've already called the hotline, but man, you still need some help finding maybe some food and some clothing, maybe some mental health services. Well, great, pop onto resources757.org and you can check out anything on there because they're all self-refer. That means you can call, I can call, your cousin who needs some assistance can call. It's not just for families, not just for homeless individuals. So all household types. As I mentioned, it's diverse in resources, everything from mental health services, veterans services, disability services, food, clothing, the list goes on and on. I do update it pretty frequently as I can. I'm just one person updating these resources. So I do ask that if you see something that's maybe a little bit incorrect on there, or, oh, I know of a church that isn't on here, but sure does offer some of these resources, go right down to the bottom of resources757.org and go to the contact us link. It goes right to my email. So I'm happy to address that as soon as possible. Direct contact for support. That's me. I'm the direct contact. It doesn't go through a bot or anything like that. And also, I'm the one who goes and finds them throughout the entirety of the 757. So it's where I like to lean on folks like you who can sometimes help me. And I left this slide open for any questions, comments, or concerns for any of us. We're all ears and we're happy to help.
I have a question. I don't know if I missed it. Correct me if I'm wrong, but I know you earlier on you were talking about a nurse practitioner for health services. I don't recall you saying anything about dental health. So I was wondering, do you guys refer to practices nearby, or you have somebody coming in-house as well to provide dental services?
For dental services, we don't have any on-site services that we offer. So we refer to other dentists that we know in the area. And I have made a guide for all of our participants of dentists in the area that are in network with Medicaid. And so it at least is an easier access for them to not have to call 10 places themselves, that if they tell their case manager that they need help finding a dentist, there's a quick list that I provide to them that can help them find a dentist.
Yeah, and we've also actually partnered with ODU in the past where they have come out and done on-site activities at our new building. I think a little over a year ago now. And so we've talked about setting that back up again, or having a health fair and having those resources. So it's a combination of various different resources.
Also, if I may, one of the buttons on resources 757 is dedicated to health services. And so I am working alongside my colleagues here to try to make sure that we have dentists that are able to work with the lower income community as well. Wonderful question. Thank you.
Thank you. Thank you.
What other questions do you have?
I'm curious, I'm imagining with how many cities you all work for, the amount of coordination it probably takes, because you guys only have so many spaces for families experiencing homelessness. So I wonder, are you guys in close contact with like the different cities? Because I know like City of Norfolk has a year-round shelter, and I'm sure other localities similarly have them too. So like if you guys are full, do you kind of link people up to other shelters that you're familiar with where they might be able to find resources immediately?
Erica, what a lovely question that is. And yes, one of the reasons why the housing crisis hotline is open and available to all of the cities is exactly that. The cities typically require a call to the housing crisis hotline before really any assistance can be made. Now, as far as the resources 757, we do not go out to the shelters very often because the case managers that Jessica was mentioning are the ones that go out there in the Norfolk, Chesapeake, Portsmouth, Western Tidewater area. And they are well equipped with the resources 757 information, and they're the ones that typically hand that out as well. Erica, does that answer your question?
So it is
Absolutely.
Okay, thank you. Sorry, Lexi.
It can be kind of confusing. So the housing crisis hotline is shared by all of the housing services in the Hampton Roads area. It just happens to be hosted at our office. So it could be an individual in Newport News that is calling, that is experiencing homelessness. So it's not just people calling that would qualify for one of our family programs. It could be for any other area. But all of the homeless service agencies in the area do a really well job of coordinating and identifying who is most vulnerable in the community and who has space at the time.
Yeah, and we do have different, like, domestic violence shelters, or sometimes we partner with. Obviously, that's not our specialty, what we, who we serve, and a lot of times it comes hand in hand with homelessness. But if somebody's at immediate risk, we do reach out to a local shelter. They still have to go through the hotline, so there's still that process in place. But that is some places that we have some partnership.
So I know you said you had the rooftop garden, and I love gardening and things like that, and community gardens. Do you have any connections to any of the other community gardens in the area that do programs with, say, school children or anything like that?
Not right now. So typically it's just the Chesapeake Master Gardeners. They come and they do every season, they get us ready. They're coming to do hydrating the systems and the irrigation systems. We do food education classes. And then we also have Healthy Chesapeake. And so they as well do food education. They're doing color on my plate right now. So eating different foods with different colors. So currently we're working with those two partners mostly, the Chesapeake Master Gardeners and then Healthy Chesapeake.
We did just start talking to Healthy Suffolk that has some community gardens about putting in a community garden at our Suffolk office, and then doing some sort of program of maybe like sending home tomato plants with families, or it's very in the initial stages, but we're working on for Western Tidewater of having a community garden aspect.
And a question from the chat. What are some of the challenges that you are currently facing, and are there opportunities for internships?
Yes, definitely. So some of the general challenges, as you can imagine, is housing. Affordable units, available units, safe units. And so that's our biggest challenge right now, as I mentioned, with even when we find those available units, the rent is over sometimes what we can pay with our grants. So we have something called a fair market rent value. We have to do comparisons in that area. So we do have limits that we have to work within. And on top of that, we want it to be affordable for the family ongoing long past our services. So housing is still a big one in Hampton Roads. Affordable housing is huge. We have a research and advocacy center who's really going to try to start digging in on that, at the local government, state government, federal government, to hopefully make some changes there. And then within services, I mean, speaking on health, a big challenge is just trust in the healthcare system. And so we've been trying to get nurse practitioners that look like the families that we serve, that are mobile, that can come to them. So having the services on site so we can start to build this trust because they're feeling safe at 4 kids. And so we're trying to bridge that gap there as well. And then just we've coined this term of like shifting the mindset. So we have a lot of different services available, have a lot of different opportunities, but we just are trying to equip the families that we serve with like confidence and skills and dreaming for the future and what that looks like to make the next steps. I would say those are for challenges. And then internships, we are always accepting interns. We usually have at least a handful every semester. The areas that we have, so we have the hotline. So maybe if they're not ready for direct service, or if they need some flexible hours, the hotline is a great place, and they are taking calls by the end of their internship. We have case management, where you would be doing a little more of the direct service, either in shelter or in homes, going to the case management meetings, transporting clients if the school allows that, which ODU has in the past. And then we have the development option. So learning about the grants, the fundraising, like how this all even works together. So those are our 3 areas. On our website, forkids.org, there's under career opportunities, it says career and internship opportunities. You actually go and apply for what position you're interested in, which I guess should be coming up really close now for our next semester, for spring and summer and fall. So always accepting interns, and love to have ODU on board.
Thank you for all of this information. My question is, could each of you briefly talk about how you came to be in the positions that you are?
Sure, I'll start. Absolutely. Thank you, Dr. Taylor. My name again is Elise Hasenstab. You said what our positions are and how we came to it. Is that correct?
Yeah, just like a brief overview of your career path to get to where you are.
Absolutely. Boy, are theirs going to be better than mine. I'm getting ready to go to nursing school, and I started at the housing crisis hotline. And then now I do this resources 757, super great sort of data entry, but also talking to people. It's really been great. As far as just a little blurb, as far as internships are concerned, I never thought that coming to work at the housing crisis hotline was going to help me be a nurse. I was very ignorant to that. And I am realizing that I have learned so much about this community and how wonderful the unhoused and soon to be unhoused community, how wonderful that population is, and how much they have to offer, and how different their needs can be. And so I know that it will be very important to me in my future. And so yeah, that's me in a nutshell. What you got, Lexi?
Hi, yeah, so I've worked in homeless services for about 6 years, since I was finishing up college, and I just have such a passion for this work, and especially for the chronically homeless population. And then in my head, I was kind of shifting, like, oh, I'm really interested in public health. I think I want to look into getting my MPH. And I just didn't feel like I was finding both of my passions. And then I started working at 4 Kids, and then this job came open for really both of the things that I love is healthcare, access to healthcare, and homeless services. So I really couldn't be happier that I found something that I feel like is so perfect for me.
And so I actually graduated from ODU, human services degree back in 2008, moved back to Northern Virginia where I was from. I was actually working for the local government doing benefits, so like food stamps, TANF, all that good stuff. And I learned a lot about policy, but what I was finding is I was referring a lot of families out, like, oh, go find a social worker. Like, you know, we can only do your benefits, that's it. And I really wanted to take it to the next further step. Ended up moving back down to this area, found 4 Kids, and started out as a family case manager, which I think was great because you get to work like the ground level. And what I found is the difference of rapport. So I was working at the government, all the families were coming into the office. And so it was great. We were able to build that, you know, rapport. But the change of actually going into somebody's home and making a difference, for them allowing you to come into their space, it's a game changer as far as building relationships, transformational relationships, and actually making change, and really fell in love with the services there. And since then have been able to, I was a senior family case manager, and then recently a year ago moved into the director position, where really excited to actually dig in and kind of lead the path as far as next services that we'll do. So, but thank you for asking.
Yeah, great question.
Thank you all so much. It's just wonderful to see the growth, because I actually I used to volunteer with 4 Kids when I was in the MPH program with EVMS and ODU, and it's just awesome to see like how much growth and advancement y'all have made. So it's really exciting. So thank you.
Thank you.
We have another question in the chat that says, are interns compensated?
They are not compensated now. Do you guys do internship through public health, through that program?
Yes.
Okay, we've never, I don't, that my knowledge, we've never had someone from public health, but that would be really great to have on board.
We do it both at an undergraduate and a graduate level. Both levels have to have internships in order to graduate. So we can definitely put you guys in touch or on the list with the internship coordinator for both of those levels, if that's something that would be helpful to you guys. I know it would be helpful to us in our program because you guys have a great organization.
Yes, definitely, that's great.
So, and and are any of the positions remote? Do you have any remote positions with internships or even volunteering at this point?
So during COVID, we were getting creative. So it was a lot of, things that we were doing. We actually never went fully remote. We were still on, in office. Some people were hybrid, but we really think for internships, because there's so much just action happening here and then in the community, you really got to be on site. I'm not sure with the development team, but I would assume same type of thing. It is more on site with us. And I do see, the volunteer link is there, lots of different volunteer activities. And we open, even if it's not on the list of something that you see, we're always open. Like if you are passionate about a certain subject and want to come teach a class, or you have a great skill, anything it might be, and you want to do it with the kids, like we're always open to different ideas and have a really strong volunteer base.
And I guess this is not a question so much for you to answer for the group, but if you have any social medias that you want us to push, especially for like your event tomorrow, and you wanted us to get the word out that the Section 8 housing is opening again, if you have any materials for that, feel free to email them to us and we will post those to our social medias for you.
Okay, awesome. Yeah, I was going to connect with our media consult, even for just the recording. So I can definitely include that all together in an email after this.
Okay, wonderful. And I will send this recording to you when we have finished up. Do we have any more questions or anything that anyone else would like to know? Do you guys have any closing statements you would like to give, or?
No, we're thankful you guys had us out here. So we love to get out and talk about the organization, and you guys are part of the community. So definitely partners in just that.
And we are grateful that you came to speak to us. We always love to hear about what's going on locally, because I know we do have some talks where it's not necessarily in the local community, but part of the PHSA is trying to get things together for the local community. So we are very happy that you guys were here today. And again, we will reconnect with you when this is done to get all of these materials to you, and hopefully you guys get the materials to us. That way we can coordinate some more events and things together.
Sounds great. Thank you all so very much.
Thank you. Have a good weekend.
Thank you. I appreciate you.